Stara's feeling it. I like it. Right there with you. I was at a conference this weekend where the niece of one of the Sledge sisters was the main act, and she was wonderful. And one of my colleagues who is a bit younger asked, who are they? I said, well, Sister Sledge. And she said, I've never heard of Sister Sledge. And my heart sank and took me a little while. Dr. N, you're not a Sister Sledge fan? Oh, you are? Okay, okay. Oh, I was worried. I thought you were putting a thumb down on that one. No. Okay.
Thumbs down on not knowing them.
I'm not knowing it. Well, we need to do a better job of introducing the classics to everybody. That might be our job. We may have missed on that one a little bit. All right. All right, well, good morning. We're going to go to a jump start today because we've got a lot going on that we need to cover. I'm going to ask folks to, if you can, join us with your cameras. I'd love to see all the smiling, happy faces that have already turned on their camera. If you can, and obviously if you have connectivity issues that make it better for you to be off camera, that's fine too. Want to just welcome folks to our group meeting. And again, folks have been, if you've been participating in the last couple of meetings, you've been in working groups, and this is a whole group meeting all together, back again for those of you who are here the first time. So thank you for joining us and coming back. I'm going to ask that we do our usual who's in the room. In the chat, I'd like you to put your name, pronouns, your organization, and what are you thankful for as we are in the thanking season? So something that you're thankful for, if you can put that in the chat. Name, organization, pronouns, and what you're thankful for. And we'll just start seeing that pop up in the chat. Good. Don't forget to put what you're thankful for. Warm blankets, I'm with you on that one. Students, kids coming home, yeah, days off. Grace, with you on that one. Safe community. Thankful for my dog, I love that one. That's awesome. I'm not even a dog person, but it sounds awesome. Sleep is big these days, absolutely. All right. Children. Thankful for my toddler. I'm not sure we've ever heard that one before, but that's great. That's awesome. I love little people too. Potlucks. All right, Tish, I'm with you on that one. All right. Chance to get to know myself. Wonderful. Having family. Wonderful. We just did our Friendsgiving on Sunday, and it's the first time we've had, more than a few folks at our house, and with all of the safety protocols taken, and no one turned up sick afterwards. So we're very happy so far and had a great time. So I wish all of you some good community building, getting together. Thank you again, those of you who are just joining, to put your name, organization, pronouns in the chat, along with one thing that you are thankful for. And as always, if you are Zoom familiar, you know that at the bottom left-hand corner are the mute and video buttons, and we'll be using the chat that's in the middle of the bottom of the screen. We'll be using that quite liberally today, so please make sure that you are able to use it. And we're going to go ahead, as folks are continue to put their name and affiliations and what they're thankful for in the chat. We're going to go ahead and get started. I'm going to shift it over to Marissa, who's going to talk a little bit about the purpose for the day. So, Marissa.
Thanks, Mo. All right, everyone. So we're going to do something a little different today. We know that we have been in working groups for the past couple meetings, and so this is really a time where we can all come together. And we know that some of you may have seen what the different working groups have been working on Basecamp, or have popped into different meetings, so you might have a sense. But we know that nothing really beats sort of having this time together where we're all here, where we can look across the different working groups and see where there are strengths, where there are gaps, where we can group or categorize, and where we may need to split up priorities to really get down to the root cause. And then finally, where we can align across working groups. So where we really want to be looking for connections and overlap. So what I would ask of all of you is, while we are facilitating the next part of this discussion, is to keep all of these questions in mind. I'll put them in the chat right now just so you have them. And we'll ask you to provide comments in the chat throughout this sort of conversation, and then we'll facilitate a discussion at the end.
Marissa, if I could just ask you, can we go to
Yeah.
slide 5 first before we slide over?
Yes.
Thank you.
Exactly.
So all of you, and you've done this before in your individual working groups, and we're just going to do it again. We just want to make sure that we have a sense of who's in the room, and we want to be able to elevate the voices of folks who are at all levels, but especially those who work directly with children. So if you want to put in rename yourself and add the number 1 if you interact with children and families every day, the number 2 if you interact with children and families occasionally, and number 3 if in your role you don't regularly interact with children and families, but have obviously a vested interest in this. So you can click on those 3 little dots at the top of your picture and hit rename, and then just add before your name the right number that goes with you. So I'm adding 3 for me. And I'll just ask if you can rename yourselves with that number. I'll just take a moment to do that. It'll help us to ensure that we are getting the proper participation and voices of everyone in the field. So if you can, make sure that you add a number to your name. All right, thank you, thank you, thank you. It's like most folks are being able to do that. Great. I'll just ask a few more folks if you can make sure you add the number that corresponds to your role in the field. And then Marissa, I'm going to hand this back to you.
Sounds good. All right, so what we're going to do next is we'll ask each of the facilitators for all 5 working groups to start by sharing the vision statements that everyone worked on during our last meeting. So we'll just read through them, and then we're going to transition that conversation to Basecamp over the next week, where we'll ask for some additional feedback, and we'll continue to edit down the vision statements. I know that each of them are kind of at different steps in the process. And then we'll ask the facilitators to share some context about the working group priorities. So share some highlights of the discussion and the conversation that the group had. How did your group sort of get to the point that you are at now? And then looking at the priorities, what are some of the strengths or gaps that you all have identified, if there are any, just to sort of kickstart the conversation. We'll then ask one person who has participated in that working group to come live and to share their reactions or thoughts. So again, looking for gaps, looking for sort of initial reactions to the set of priorities that are listed on the page. And then we're also going to ask one person who has not seen the working group priorities yet, so someone who maybe wasn't a part of that working group, to share their reactions and thoughts. While all of that's happening, I would highly encourage everyone to share their comments in the chat as well, so that we can get sort of as much information and feedback as possible during this process. And then we'll transition to the next working group. So we'll run through all 5 of those, and then we will open it up for some more discussion, and we can really think about aligning across the different working groups at that point. So with that, I am going to turn it over to Mo.
Awesome, thank you so much. We're going to do this pretty rapid fire, so we'll go through each of the 5 working groups. I'll ask the facilitator to come forward and give a few words, and then we're going to try to get some of your comments in. You'll have a chance to see the priorities that as they are right now. We're looking for your comments on them, and I'll ask you to put your comments in the chat as we go, and don't hold back. Like, we really want to hear from you, and then we will go live for a couple comments from folks under each one, but we're going to go pretty quickly. So to kick us off, we're going to start off with financially secure families. Come forward, facilitator.
Morning. I'm just gonna switch to gallery view because I cannot see you and I'm recording. Okay, morning. My name is Nettie Garcia and I am the facilitator for Financially Secure Families. This is our vision statement and priorities list as of yesterday around 3:30. And there was some chatter in the base camp after I shared this with Marissa. So, again, anybody who is in the Financially Secure Families working group, please chime in with your comments. Or also go to Basecamp and add your comments there. This is our vision statement. Identify economic barriers to set priorities and create solutions centered around families with young children that will meet their fundamental basic needs with dignity, ensure access to equitable, high-quality childhood services, improve financial health leading to sustainable economic security, eliminate racial disparities and promote racial equity through income supporting policies, stabilization programs, and intentional collaborations. And this is our priorities grouped. This is not what we voted on. These are our top 6. This is just how we grouped them based on all of the various problem statements that were entered. Priority number 1, inflation, rising costs of living, housing, utilities, food, basic needs, paired with wage inequality and stagnation of earnings for low-wage workers. Priority number 2, workplace policies that aren't family friendly, limited access to paid parental family leave. Priority number 3, not enough awareness about and barriers to existing supports, complex systems, hard to navigate, repetitive nature of application processes, fears around immigration status, income thresholds, cliff effect, language access. 4, need for childcare that is designed to meet the unique needs of children and families in sometimes evolving circumstances, equity, access, affordability, flexibility, and transportation. Priority number 5, need for financial education and barriers to asset building and generational wealth. Priority number 6, lack of adequate safety net to ensure families can meet their children's basic needs.
All right, so we want to see a really active chat here. So take a moment and we'll start to see your comments. Neri, did you want to ask one of your folks to give some perspective?
Yeah, if someone from our working group could I didn't ask you ahead of time, so I apologize, but if you wouldn't mind chiming in about the vision statement as where it is now, and then also the priorities list.
We're also getting lots of good feedback in chat, so if folks want to come live too.
All right, Nari's way nicer than I am. She knows who is in her working group.
You want me to pick someone? I could pick someone. Let me see.
I would love for you to pick somebody. Oh, there we go. Adam's got his hand up.
Good, because I was going to pick Adam anyway.
Go ahead.
Thank you, Adam.
Give us your 1-minute overview of what you got.
I'm glad we're on the same wavelength, Eddie. Yeah, I think that this vision statement is the product of a lot of really collaboration, but I guess trickier conversations we had last week, trying to really parse apart like the language and making sure that we were being appropriately bold and inclusive and very intentional in our language. So I'm thinking about like the racial equity piece, for example, making sure that we're including that in a way that that actively represents our goals for equity and inclusion. Making sure that our statement wasn't just about childcare, which I think is kind of a default of a lot of the folks. I know a lot of us are 930 callers, and that's kind of like where our head goes when we think of financial stability. Yeah, this is off the cuff. I don't have any prepared remarks, but I'm proud of the statement because I think that we really put our heads together to try to be as expansive as we could while also being focused in our intentions for what we think is realistic and important for the coming legislative session.
Wonderful. Thank you so much. We'd love to have a comment from somebody who works directly in the field, somebody who has a one next to your name. If you could come alive and give us a comment on what you see in these priorities. Is there a brave and lovely soul? Don't make Yasmin have to comment on all of these things.
Yes, I am going to have to comment on all of those things. Obviously, when my students are watching us discuss this and are going to be paying to become the workforce that we so need, we're never going to be able to fit everything in to make a concise report out there. So the collective response and looking at the priorities, there's always probably going to be room for improvement, but I think that we have what it takes and we can move forward. And with the priority 3, the not enough awareness about the barriers, if we could somehow get that, I don't know, you know, that super fancy word that sums all of that up, like poverty or something. I'm not sure what it is, but I think all the work everyone's doing is spot on. I don't know what more to say there, but good job. That's my take. Any response here? They said they agree.
All right, somebody's getting an A in that class. I can tell. Good stuff. Good stuff. Please continue to put your comments in the chat, and we've got time for maybe one more live comment if someone has something that they want to add about these priorities, or if there's one that you want to comment on. I did see in the chat some energy around combining a couple of these and some language, which is wonderful, exactly what we're looking for. Is there anybody who wants to comment on these? Remember, we've got 4 more, so you don't feel like you have to get all of your comments done right now. You'll get other chances. Anybody else?
My thought would be about different languages that I'm finding in the field, especially women from Haiti and Afghanistan do not read or write in their own language. And so we have to have a way to get things like on YouTube or, you know, like for me, I would love to put some of these videos on the Worcester Healthy Baby website because it's easily accessible to both professionals and families in our area. But, you know, figuring out places that people know to go to that are reliable, that has the information in multiple languages in a video and not just in written format, I think is going to be a big key going forward with the refugees that we anticipate for Worcester anyway.
Thank you. Great comment. Absolutely. Wonderful. So I'm going to tell you the 2 things that you already know. You will be able to continue making comments on this electronically on Basecamp. We'll please continue to provide comments here if you have any others, but we are going to move to our next area, our next working group, which is high quality experiences, and I'll ask that facilitator to come forward.
Hi, everyone. Marissa Fear. I'm the facilitator for high quality experiences. All right, so our vision statement is set priorities that promote equitable, culturally and linguistically responsive, child and family-centered services and resources that enable young children to live, play, and learn in safe, nurturing, and inclusive communities that support their growth and development so that they meet their full potential. Seeing Yasmin's response, which is a good one. All right, so we will continue the engagement on that in Basecamp, but now I want to focus in on the 6 priorities that our group has identified thus far. So priority number 1, the importance of early childhood isn't well understood and doesn't line up with how the workforce, programs, and services are viewed in society, that there's a negative perception. We don't prioritize children and families. We devalue care, education, social services, and health. So sort of all of that in one sort of perception of early childhood. Priority number 2, the standard of high quality programming is unclear and many programs lack quality improvement plans. Priority number 3, recruitment and retention of qualified staff prepared to deliver high quality programming is a challenge. Priority number 4, the early childhood system does not incentivize or support the development of high quality programs and services. Priority number 5, racial equity is not embedded in programs and services. Priority number 6, policy and practice is not grounded in child development and brain science. So those are the 6 priorities we have. And in a second, I'm going to invite someone from the High Quality Experiences Working Group to share any thoughts. But just to kick it off, I wanted to start by highlighting a couple things. So first, I wanted to share that I think it's really interesting that priority 1 and priority 6 are really high level. And I think those 2 statements could sort of apply to any of the different sectors within early childhood. So when we think of social services or health or care and education, that sort of applies across the board, and they're also very big things. So it'll be interesting to kind of transition that to action and to solutions and to really focus in. But I'm going to invite a 1 or a 2 from my working group to join and share some initial responses or feedback from the conversation.
So this is a time where we give you a chance to volunteer and bring forward, and we'll ask for comments from folks who are part of the working group, and then we'll volunteer you. So if there's somebody who's participating in the working group who can jump in and provide their comments, we'd love to hear from you. Brave and lovely soul.
I will, if.
Thank you, Ruth. Go ahead.
Sure. It sounded really, the vision statement sounded really great when we were sort of wordsmithing it, but when you read it out loud, Marissa, it sounded a bit run on. So
Yeah.
maybe just some tweaking of the actual way that that's presented was my only first thought there.
All right. Wonderful. Thank you, Ruth. And we'd love to get a comment from someone who works directly with children, a number 1. And I know I've saw some folks out there. Donna, is that a hand up?
I do have my hand up.
Wonderful.
I actually peeked at their stickies because I was interested in what was being said there. And I want to kind of call out on number 2, priority number 2, that programs need funding to pay for the time that it takes for program leaders and educators to develop quality improvement plans, because it takes time, which costs money, in order to really look at what we're doing and how we can get better. And so that brings me to the funding issue.
Wonderful, thank you. And just to say, we are getting some great comments in the chat as well. Please keep those up. I'd love to hear from somebody who is like west of Framingham. Anybody west of Framingham? Somebody from Worcester maybe, or Springfield, or Fitchburg, or Leominster, Gardner. Anybody from west of Framingham?
I'm out west, so I covered that too.
You got that too? Wow, Donna, you're hitting all the bases today. This is great. Anybody else on high quality experiences? Oh, Kim, absolutely, and wonderful flags. Really appreciate that.
Mine's more of a question, as I'm not an educator, but I have friends who are early childhood educators, and what I hear from them, and so I don't know where this is included, is the challenge of working with children with maybe differences or disabilities or emotional differences and their own safety at times. And I wonder if they're concerned for their own safety. I mean, I've heard of them going home injured with bruises from children, and we were talking even young children. And I wonder, is that an education on the side of the educator? Is that where is that in here somewhere?
That's a really fantastic point, Ruth. I'm going to actually tee that one up for the next working group, because I know there's one that I think will address your comment perfectly. So we can kind of circle back to that comment on the next one.
All right, Kim, that means we're going to bring you back next one. This is awesome. I love it when we get people multiple times. It's great. Anybody else with a comment in this one? And just again, thanking people who are putting their comments in the chat. Really appreciate that. Anybody else want to come live and add a comment?
I will. I just want to say in the chat, some folks are talking about mental health. I'm just going to say it out loud too. I think that even given what Kim was saying, it's having more mental health for like embedded mental health support somehow for programs for teachers as well.
Great, thank you. And please make sure if you feel the desire to elevate it. All right, Kim Davenport, go ahead.
Hi, so I would echo the comments from Kim and Sarah. I'd even broaden it to other comprehensive support. So supports for children with special education needs or emerging needs that we haven't quite identified. Like, I think there's a bucket that to make high quality experiences happen, there needs to be this comprehensive support view of what programs are able to build and deliver, and they need the resources to do that.
Wonderful, thank you. Colleen, go ahead.
Okay, there we go. So I just wanted to add on to that. So I do professional development training for child care centers, and I am repeatedly getting requests from directors for trainings on wellness and mental health. So I just wanted to add that in.
Absolutely.
Can I really quickly? I think that everything, a lot of what we're talking about is encompassed in number one. Okay, it's the importance of making people aware of what early childhood is, right? So we know there's a huge SPED department once they get to kindergarten, right? That will help and support and all of that. So I think we just really have got to, just not call it early childhood education, but call it education and care under the umbrella of stuff. So how the workforce programs and services are viewed in society. People don't know that 3-year-old kids who are extremely traumatizing can be very violent, right? And you have to have experienced teachers to kind of identify that. You have to have parents that see the educators as professionals. So when they say, we might not be able to handle your child, or your child might have this, I just think everything is encompassed in number one, or a lot of stuff is encompassed in number one.
Thank you, Dr. Ann, and thank you all for the wonderful comments that you've put in the chat, and continue to do so. We're going to ask you to continue to put those comments. This will be available on Basecamp as well. And just so we don't get things confused, if you're making a comment about one of these sections that is not currently on the screen, just go ahead and write like the name of that section in the beginning of your comment. So if you make a comment on high quality experiences, go ahead and say high quality experiences and so forth. Otherwise, we'll just be commenting on the current topic that's on the screen. All right, just so we don't get things confused. And also you can go into Basecamp and make your comments there as well. Those of you who are Basecampers, I've been waiting to say that, you can tell. All right, let's move on to the next one. We've got thriving early childhood workforce. Could we ask that facilitator to come forward?
Thank you, Mo. It's Amy O'Leary, Executive Director at Strategies for Children, She, Her series. And Workforce Warriors, I know you're out there. First, I also want to appreciate all that's going on in chat. So here is our statement. Identify barriers and set priorities that will lead to a diverse, effective, and well-prepared early childhood workforce that is equitably compensated, provided with adequate benefits, has access to professional preparation pathways and career advancement opportunities to support high-quality program and services and guaranteed positive working conditions within a workforce culture of equity, fairness, stability, and pride for all professionals working with children from prenatal through age 8 and their families. Now, someone mentioned a run-on sentence before about high quality. We see your run-on sentence and we raise you to a paragraph. But I think this really reflects, we had so much feedback on this. So if we want to go to the next slide, so please add in Basecamp or here. And one of the things that we have observed, we are working probably like a day ahead of everybody as we collect all the information on Basecamp. And as Marissa and I talked last night at 10:30 p.m., we know that there are overlaps. And kind of today's opportunity is to really kind of get everything out there. And then as we move forward, as Titus has been saying, we're halfway there. So getting all of this out, seeing where there are kind of across overlaps, within overlaps, is what we're thinking about. So here are the priorities that are laid out. And the other comment I just want to amplify was Adam, when he talked about how some folks, we can tend to sit in this early ed and care framework, and that this is really broader. And I want to thank the folks who are part of the workforce who really pushed us to think about other professionals that we need to think about. So priority 1, many early childhood professionals don't have access to benefits or they're a high cost burden. Number 2, struggle recruiting and retaining early childhood professionals, including professionals with specialized training. Number 3, early childhood professionals do not receive worthy wages. Number 4, there is not a competency-based career ladder or professional credential for early educators, FCC and center-based. There is not an integrated career lattice for early childhood professionals to move between fields. The early childhood system does not encourage staff wellness. Programs lack the funding to be able to offer competitive compensation, and higher education is unaffordable and inaccessible to the early childhood professionals. I just really want to look at number 5. This idea of wellness really came up in our discussions, and it sounds like it's been coming up in the chat, thinking also around the support services, around mental health, around paid planning time. So all of those pieces in our discussions were really centered in wellness. So I would invite any of the workforce warriors who are with us this morning, especially if you are a 1, if you have any comments or reactions, and then we'll go to someone who was not part of the discussions with our group. So any reactions?
Workforce warriors, step forward.
I would like to say something.
Bernadette.
One of the things that bothers me a lot is the low status of caregiving in general within our society. And I think that has a direct impact on the wellness of the field. I think the fact that society doesn't recognize the intelligence, the emotional health of the providers that's necessary to take care of families and children is causing major depression and fallout in the field. So I think it's the status of the field that is seen as a no-win career for people who can't do anything else. And it's driving some of the more passionate and dedicated people out of the field, combined with the low wages.
Thanks, Bernadette. I did see the comment in chat about potentially combining 3 and 6. And I think we talked specifically about it's a 2-prong, right? It's the funding mechanism why we can't, increase compensation, but we also wanted to make sure that there was a statement about not having compensation. So while I think, and to Bernadette's point, that is all connected to the status, and that did come up in our discussions. Thanks, Bernadette. Anybody else, a 1, 2, or 3 that maybe did not participate in these discussions here or on Basecamp? Or hi, Danielle, how's it hitting for you?
Hi, I'm not a workforce warrior, but I think we all kind of are.
We all are, Danielle, thank you.
I have 2 comments. One is that I really appreciate you including the career ladder. Perhaps something around leadership specific in there might be important. I think we often promote because somebody's really good at teaching, right, and that is not necessarily leadership. And what sometimes happens is somebody gets into that role and was not prepared for what that really means, that difference, right? That when you're not in the classroom, it's a whole different world. But there also is not kind of a ladder or a mid shift for interested staff who want those kind of opportunities. It's kind of an either or, and that can be really frustrating. And and what happens is because of the wages, we lose those really integral teacher leaders because they don't want to move on, but need to and deserve to make more money. But also this idea of specialized training, I think, is so integral, and the previous conversation started to touch on it, but we are getting so many children with challenging behaviors, with trauma, on the spectrum as early as 2, so often. And forget higher education, our teachers need so much support and so much knowledge to be able to do this inclusive classroom model. And this, it's hard enough to have mixed ages, which is the gold standard, infant, toddler, and preschool really is toddler preschool now. It's 2-9 to 5.5. That's very specialized and unique. And, I'm just really happy to see that language in here because we always think of, well, we need support staff. No, our teachers need to be specialized. They're specialists, just like in elementary and higher ed. And, it is very different. And I just think that, you really touch on a lot of the differences, and it's so important.
Wonderful.
Right, couple comments to go, Chandra, and then Marcella.
Hey everyone, Andrea. So I am in the high quality group, but Marissa knows that I am always putting my workforce hat on. I am actually in DC, and I left the classroom in 2017. I worked in public schools, but I've also worked in center-based communities. And so I always tell people this everywhere I go. Money is great, but Danielle also touched on that point of support from administration, because I made good money in public school, but that's not the reason why I stayed. The reason why I left, I tell people, it wasn't the children, it wasn't the families. I knew what I was getting myself into, and I still decided to help them and to interact with them and learn from them, because they do have assets, but the lack of support from administration is what ultimately that was my decision to leave the classroom. It was super hard, but that's why I always want to make sure that yes, training is important, money is important, but if people who are working with young children now are having to do so much, if we only ask for money, they're still going to have to do more work. I'm telling you that money comes with an asterisk. So we have to ask for support along with the money. We only ask for the money, they're going to give us more to do. So it's
Thank you, Chandra. We got one more moment for Marcella. Jump in. Marcella?
She's on mute.
You're
Unmute,
muted.
Marcella.
Hello, thank you. Such an honor to be here. Those of you who know me know that I am all about advancing leadership in family childcare. That's the field that I love, working with Latina educators. And thank you, Danielle, for adding this comment about leadership. I know that in Western Mass, I'm going to give a huge shout out to Western Mass. We have been developing leaderships in our region. And I personally have been working with several family childcare educators, preparing them to be facilitators and PLC experts. And now they're part of the Strong Start PDC centers. They are providing their own training. So we need to find ways that we are all in the state doing that for our teachers, for family childcare, especially as we're talking about their wellness and just how to raise up who they are in this community. Thank you.
Thank you so much, Marcella. And again, we can continue with comments on Basecamp. You can continue to put comments in the chat. Just make sure that if you're talking about thriving early childhood workforce, just write workforce before your comment if you're still commenting on that. If not, we're going to move forward to our next group. If we want to bring up robust system infrastructure and local partnerships, come down.
Thank you.
Facilitator.
Can you hear me, Mo?
Yes, sir. Go ahead.
All right. And I love Claudia's chat just now about home visiting programs. We are mindful of the early childhood professionals in whatever program type or service they are in. So please be bringing that to your chats and your comments in Basecamp. Okay. When Amy said that I said we're halfway there, I thought she was going to ask me to sing Bon Jovi. So thankfully that didn't happen. But we might have karaoke later in the process at a future meeting. Okay, so this is the robust local group, which is what I call it because there's just too many words, I think, for the title. But robust system infrastructure and local partnerships. Our vision statement includes building on what already exists, and there is a lot that does exist, but partnership is key to that. Centering families in basically all of the things that we would want. Promoting equity, accountability, responsiveness in the ecosystem, cross-sector, being transparent. Data is the key noun there, but transparent, accurate, accessible, timely, equity-centered data. And then there were two pieces that didn't make it quite into this yet, but we are still editing. Build and sustainably fund this robust system infrastructure and local partnership, and also leverage federal funding, because we know that federal funding is key to system building. Next slide, please. All right, we had 7 priorities after an extensive discussion, 2 discussions using the group map and adding things and refining things in the group map and voting in the group map. My group was able to vote. We were moving quickly, so we had fewer discussions and more voting maybe, but this is roughly the order of our votes. So this is in a particular order of what got the most, and by far the most vote was the top one. Collaboration, including public schools, relative importance of early childhood versus K-12, collaboration across those boundaries. And this includes not having a seat at the table of your own local town or city to bridge the gap between, and I would say, early childhood programs and K-12, right? To be even broader than early education and care. Number 2, data, shortcomings of common data, outcomes, data infrastructure. 3, challenges facing families, lack of family center support that's easily accessible on several dimensions. Funding streams, number 4. cultural humility, priority number 5, and thinking about racial equity and cultural humility as a piece of local infrastructure. Just as like a personal thought on that, I mean, the state policies tend to be culture blind or not culture specific. There are things that can be applied one size fits all across the state, but we know the closer we get to community level, neighborhood level, you know, you can't create a policy or a project that just ignores culture, and cultural humility is a key piece of that, whether it's training or structures or systems of support, as some previous folks have mentioned. And then local leadership, this kind of ties in with number 1 maybe, but it is a little bit different. Having a person who wakes up every day focused on the local ecosystem. That doesn't exist, except it does kind of exist in some communities, but it's not, you know, by design, sort of accidentally or fortuitously happens when people step up to be those air traffic controllers in the local community. But that's not baked into the system currently. And then, you know, lack of common definitions, lack of a system map. Who are we talking about? What are the moving pieces? There are some pieces in play, like EC 101, like a systems mapping project that I believe Urban Institute is working on. So there are some pieces that will be coming soon that will help with number 7, but it's still a challenge. Yeah, and I also wanted to mention before people come off mute and share that these are written in kind of the negative. So I saw several comments about how we need to be asset-based and frame these in positive wording. I think we are getting to that in the future steps. So we will have solutions-based, asset-based language at a future step and in the final product of the early childhood agenda, but we're still kind of finalizing shared agreement on the challenges. That's why the wording is kind of how you see it framed.
Thanks, Titus. And just reminders that we want to hear from somebody from the working group. And we also want to lift up voices of the folks who work directly with young people. And then we also want to get comments from folks who are not in the working group on these priorities. So let's start with somebody from the working group. And again, your chance to volunteer. From the working group, and work directly with children, a 1 or a 2 from the working group. And then Titus is just gonna, Danielle, all right.
So I am actually in this group.
Yep.
So this was a really, and I of course, you know, we're not all privy to everyone else's kind of conversations, but this was really a robust conversation, if you will. There was a lot of back and forth with a lot of things. What kept coming up with was this idea of kind of who's at the table, where is the voice, you know, how are we going to get everything kind of aligned and streamlined and communicated, because it is so fragmented and kind of fractioned out there. So, you know, and really including the public schools, because that's our stream, right? Like that's where these children are going. And that is often where the voices are. So, you know, I read a really great article yesterday, you know, I don't know if it was great, but the Boston Globe had published an article about the challenges in the Boston public schools with around their special education. And, you know, and the children that are going in and the delay and all these things. And of course, you know, they're going to be able to kind of bring that to the forefront and talk about it in this really big way, but we've been enduring that for a really long time. You know, so it kind of getting into that same table makes a big difference, you know, when we really kind of need to talk about infrastructure and partnerships and funding and things. But, you know, this list really, I think, encompasses a lot of, I don't think anything's total, but, you know, all of the different pieces that we really need to think about when we're thinking about partnerships and infrastructure. You know, it's not just wages, it's not just funding, it's not just policy, but all of the things that make those things successful at the local level. Like really thinking about programs, agencies, and then, you know, policymakers and things like that.
All right, thank you, Danielle. We see some great comments in the chat. We've been joined by Dr. Lucas. Thank you so much for your wonderful comments there. Any other folks that want to come live and make a comment on this? Maybe somebody who was not in the working group? It's a brave and lovely soul. Any other comments? Go ahead. Jump in.
Hi. Good morning, everyone. I think there's been a lot in the chat about healthcare linkages and partnerships, and I would say that there's an opportunity to think about connections, especially when we think about local partnerships, community health centers and community mental health centers, and the local resources that support families with health, whether it's adult or child health, right? As we think about two generational needs and the fact that educators, our parents and educators, all the adults need to have better support for their health as they care for children, as well as we think about pediatric care. So I think there's an opportunity to think about those partnerships when we think about the infrastructure that wraps around some of the points raised here.
Wonderful. We've got time for one more comment on this one. Is there a brave and lovely soul that would like to add to that conversation? Anything else that came up for me from these priorities? Kim, awesome, go ahead.
So kind of touching base on Aisha's, what her comments are, to think about in the future, this possibility of like a universal healthcare that encompasses early childhood education and care that is accessible to all, as an infrastructure where there's no delineation. It's all together. Is something that I would kind of throw out there as you're talking about solutions or opportunities. I think it's a possibility.
All right. And again, if folks have further comments, they can add them in the chat, and also go to Basecamp if you're going to be commenting on robust systems, infrastructure, and local partnerships. While we're in the other ones, just put robust to start us off. Somebody did RSILP, which is like just as big as saying robust. So either one is fine. We'll take them. Someone asked for the definition of cultural humility. I just put a definition in there in the chat, and if you want, you can follow up with me. I can give you a lot more resources on that. But we're going to move to our final group, I believe, which is the financially secure. The next group up is Healthy Beginnings. Wonderful. And I'll ask the facilitator from Healthy Beginnings to come forward.
Thanks, Mo. Hi, everyone. Jenna Nguyen, project manager at Strategies. So our vision statement for Healthy Beginnings is to identify barriers and solutions that improve the physical health, mental health, and early relational health of children, their caregivers, and early childhood professionals, and also to support the integration and coordination of the health system with early childhood systems and programs in order to effectively facilitate transitions and nurture the foundation of all growth, development, and learning for children from prenatal through age 8. Okay, and then so our group took a little bit of a different approach. I know we were talking about challenge statements, but I think with the conversations that we had, because Healthy Beginnings, a key part of it is the healthcare system, because healthcare providers are the first point of contact with families and oftentimes are the primary referral sources for other transitions of care. We kind of talked about the coordination, alignment of the healthcare system with early ed and care, as well as other early childhood systems and programs. So what we've done here is kind of listed our priority areas, and underneath each priority area are a lot of challenges. And I will welcome my group after reading these to share any of the challenges that really kind of surfaced as we were thinking about these. So priority number 1, transform the pediatric ecosystem by centralizing the health, and early education and care systems for early access and navigation for children and their families. Priority number 2, develop structures in prenatal, maternal, and pediatric primary care and early education and care to ensure that families are driving how navigation supports are implemented. Priority 3, create accessible and culturally and linguistically responsive information to families. Disseminate this information by building on, expanding, and strengthening existing family provider partnerships. Develop public awareness campaigns to communicate with families and provide them with relevant information about how to navigate the health and early education and care systems in multiple formats and channels. Priority 4, invest resources in building the capacity of healthcare providers and educating them about the early childhood system, how families engage with it, and support more communication across early education and care and health providers. And then priority number 5, create and provide opportunities for families to engage in decision-making roles to inform programming that impacts the lives of children and families. So you'll kind of see we took this approach of thinking about the system, how to align the systems, making sure that we're looking at structures that ensure family voice, having it be family-centered, but then also looking at access. Are we providing information to families that is accessible, culturally and linguistically responsive? And then are we supporting the providers, the educators who are actually working with families to build that trust?
All right, wonderful. Thank you so much, Jenna. And looking for somebody from the Healthy Beginnings working group, somebody maybe a 1 or a 2 from that Healthy Beginnings work group. And again, we'll let you volunteer and jump forward, and then Jenna will find you. That's a brave and lovely soul from Healthy Beginnings. And Jenna, maybe you could politely ask one of your group members to join.
I think they're all being polite. Aisha, you're on my screen. I know I saw Danubia earlier.
Oh, let's get Danubia. We haven't heard from her today.
Thank you, Mo. Good morning, everyone. Well, this was a great experience. And, one of the reasons why we really were trying to connect there were so many experts in the room, and it was very hard as we started really broad, naming all the different things. But like one of the first examples, like children need diapers and there's a shortage of diapers. But if we brought diapers, would that fix the greater system? So we actually had an additional meeting, because once we defined what Healthy Beginnings looked like, we realized that we were spread so thin, which is exactly how the system is nowadays. So we dreamed, right, of what Healthy Beginnings would look like, and then how would we align ourselves to make sure that this would become a reality. So we took a little bit of a different approach, because we can get bogged down, right, just by looking at the amount of problems. So it was a great experience, and my team was great at providing feedback and creating this amazing set of priorities.
Wonderful. Thank you so much, Danubia, and thank you for being drafted in like that. I appreciate you stepping up. Anybody a 1 or a 2 from that working group?
I can step in a little bit just to add. I love Danubia's description of our process was really spot on. I would add, I think we were trying to think a lot about the integration and connection between pediatric and healthcare and early childhood education, right? With a little bit more of a narrower view on the healthcare service delivery, right? Rather than sort of capital H holistic health, because we started there, as Danubia said, so broadly and so big. So just to flag that, I think people are really raising up some key things in the chat that I think we also had on our mind, which is the opportunities to elevate educators, right, to the same level of professionalism and support that healthcare providers get, right? And make sure healthcare providers have just as much knowledge about what early childhood educators do, like think about parity in that space, which kind of links back to some of the other work groups comments around workforce. I also think that parents first and parents centered was a really key part of our conversation, right? How can we be culturally humble and have cultural humility and awareness, and really make sure that we're bringing all parents in and raising up their knowledge in this, right? And centering them in the experience. So those would be the two key pieces I would add.
Thanks, Danubia and Aisha. I also wanted to ask if Amy would like to share. I'm looking at our ones and our twos. Or Dodie.
Jenna, can I speak up? It's Shannon.
And then maybe. Hi,
I
Shannon.
was in the Healthy Beginnings group, but I couldn't make the additional meeting that you guys had. And I know I made several comments in Basecamp on the document and in the chat. But just reminding folks again about the role of childcare health consultants that can be actually health professionals embedded in the system, not a separate system like healthcare that needs to be partnered with, but an embedded system that's potentially could be supported by, we'll say, state funds or something like that, like in other states that have registered nurses that are formally paid by state funds that go out to programs and provide this technical assistance and support to early childhood professionals. Thank you.
I think we're still reaching out to see if we can hear from Amy or Dodie. I haven't heard your voice in a very long time.
Hi, Mo. I'm going to actually give it over to Amy because she's got more direct experience than I do.
Wonderful.
If you're willing to speak, Amy. I know you always have really great things to contribute.
Sorry if I'm saying your name wrong, but right before Dodie, I think it was Shannon that was talking. And you're absolutely right. And what I do at Pranay, I'm the universal newborn visiting nurse. But really, many of these families need like case management. And I spend a lot of time like calling Family Health Center or calling EMK and then calling high risk and sort of connecting the dots and tying in early intervention. And, you know, maybe if DCF is involved, I'm asking DCF to refer to parent aides, because we do have parent aides that are really a great resource to help families navigate our wacky system. But, you know, if we had state funding for a program like what Shannon's talking about, I mean, I think that that's a lot of what I do, but I'm one person for the entire city of Worcester. So, you know, yes to everything we've been talking about.
Thank you, Amy. Dodie, you sure you don't want to add?
I think the only thing I would add that I think was really important in our discussion and doesn't really come out in any of the materials is the tension between wanting to have families have as much control and centeredness in the process from the very beginning without burdening them. And that's a really hard tension. And it just came through in every discussion that we had. And so I just wanted to give voice to it. I'm not sure how we resolve it, but we just wanted to kind of put that out as a value that we really want families to drive the care for their children, but we don't want to leave it up to them to figure it all out by themselves. And unfortunately, we often kind of get in the driver's seat for them instead of really helping them stay in the driver's seat and support them there.
All right. Just want to open up. Go ahead.
Sorry, I missed the last meeting, but to what Dodie is saying, like, I find that, again, we've been talking about funding and sort of all of these administrative things that we do, if you will. But when I go on visits, I try, if there's an issue, to make the phone call with the family. But for example, yesterday, I spent 47 minutes on hold to get a provider at Family Health Center. And I just don't have the funding or the time to sit for 3 hours at someone's house to help them make an appointment. And so there's so many facets of how do we keep the family in the driver's seat without overwhelming them. You know, if you don't feel well, you don't have 3 hours to be on hold. And it took me 3 phone calls and emails to get somebody. And this is like every day for people. So I think that that's like, we could have an entirely different work group on that one issue.
Thank you. Any other quick comments on this one? Well, you can keep making comments in the chat, and obviously for all you base campers, you can go on Basecamp and make comments on all of these. We're going to continue to take individual comments on these different work group topics, but we also want to spend a little bit of time kind of looking at this as a whole and getting your ideas about where is it that it makes sense to bring some things together. So I want to start by just asking, now you've seen these priorities for all 5 areas, the work of all 5 working groups. Overall, any strengths or gaps that you're noticing? Anything that you want to comment overall? Strengths or gaps? And of course, I'd love to hear from some of the folks who haven't spoken yet. I'm not going to call anybody out, but if you haven't jumped forward yet, it's one of our values to really step up and bring your voice forward. So
No, as folks are thinking, Joanne Gravella kind of asked a logistical question about why phrases are highlighted in yellow. So Marissa, do you want to share?
Yeah, I can jump in. It's actually, you teed us up perfectly for this, Joanne. So what we did yesterday was when we were going through the priorities, we tried to pull out places where there was like obvious alignment, where we used the same words, or where it was clear that 2 of the different working groups had very similar sort of content. So just to sort of tee off this conversation, we'll go through them, but the yellow highlights are areas where there's been alignment between different groups. And we can kind of zoom in on some of those, but we wanted to give you all a chance to start the conversation first.
Anybody want to jump in? Any strengths or gaps that you're seeing in what's been shared today? I saw a lot of likes and things in the chat, so I know that y'all liked some things. So any strengths or gaps that you saw?
Hi, this is Katie from Every Child Shines, just in East Boston Social Centers, just chiming in to say I think it's great how inclusive I think a lot of these priorities are in terms of in identifying action steps. I think a lot of things would fall under them. I don't think there's much that would get, that wouldn't fall under them, but I think that's also a challenge, is that it provides some focus and prioritization, but it's a lot. There's a lot to be done, and to do it well, and to be inclusive, you really do need to look at a lot of different pieces. And so it's just a matter of, I think, boiling these priorities down into really actionable next steps. But it's great to see, and I think it's clear a lot of thought went into these.
Thank you for that. Any other comments on strengths and gaps? There we go. Danubia.
One of the things that I loved was, even while we were in this process, we wanted again to do it all. And then we realized that, we need to trust that these other buckets or these other champions will carry this out. Once we have a destination that we're going together, it's just trusting that the experts will bring us there, and then building that trust and relationship among each other, where we can hold each other accountable and remind each other, like, hey, we're forgetting to take this thing with us. Let's not forget, we're in this together. So even through this process, we were able to let go of some essential pieces and realize that those other groups were probably talking about that, and that we could communicate with each other and elevate what was important to one group and another. So that was a beautiful sample of what it could look like in real life.
Absolutely. Tish.
Thanks, Phil. And Danubia, I so want to echo what you just said. As a 3 who's just sort of really started diving into the world of childcare at the Office of Economic Empowerment, this is just such an amazing network with so much wisdom. And I'm so excited for our outputs to sort of reflect the process. And I think that in a way relates to how the industry is viewed, and for, you know, everybody to be able to see that there's so many professionals here with just decades of experience, and there needs to be so much more respect for this. So even through the process, I hope that gets reflected in the outcome. Yeah.
Thank you, Tish. Other folks, any other strengths or gaps?
Kim Davenport added to the chat, are going to pressure test this content, especially the family pieces with families, parents. I want to make sure, I want to know, and we are getting this right and not making assumptions.
Thank you, Kim.
Can I add on a separate thought, Mo? So separate from that is I think I'm like giddy with excitement that all this work that I know we had to beg and borrow everybody's time, you know, and carve out at, you know, midnight or 10:30 or 6 a.m. or whatever it was, and group meetings, and trust the process, I think, which we knew was architected well. Thank you, Marissa and team, but just having to trust it, that it actually is getting us somewhere. So I just wanted to celebrate that. And I'm grateful for the fact that I feel like we started this process and it was a little bit mind blowing. Like, how are we gonna, will this really? And I know we're still in that early trusting stage, right? Because we want to get somewhere. And I'm channeling Diane Ethier, like, I've been around forever, like, let's do something and get somewhere. But I feel like this really did get us to our next good spot, and we can have a really strong foundation for launching the next level of this work. And I'm grateful for all of my colleagues here and those that aren't here right now that have contributed to this. I feel like I grew and can be better in my work for participating. Thank you.
Awesome. Kim, we're gonna have to take that quote though. I'm just gonna tell you up front. I'm not even gonna let Amy ask you for it. I'm just taking it. All right. Tish, did you have another comment?
Just a clap.
Just a clap, oh, sorry. It's like Pavlov. Any other comments? We do want to talk a little bit about, are there opportunities to combine or make categories between and among some of these priorities? And so we saw some in the chat that were about combining priorities within a working group's area. Are there any that you're thinking about combining across, or any themes that you saw across working groups that you think maybe we can collapse together and put to one working group instead of having in multiple working groups?
As folks are thinking of that, I just also want to amplify what Danubia just put. This work builds on what's happening. We are not starting at ground zero. We know that for so many of these pieces, there are decades of work behind it. There are new things, there are new funding streams, but we can't stop fighting. And so I think that spirit is really what we're coming with. And I think initially there was some worry about that, like how will this all fit together? It is becoming even more clear, I think, as we're collecting this. And so I think that's going to be part of our next step, is like, where can we really strengthen, build, bridge pieces that are already happening. And Mo, I see we have two hands, so I'll turn it
I
back.
am so excited. I've been waiting for Leah's comment all day. Leah and then Eliza.
I'm sorry, I was trying to get on earlier. I am very excited, and the language of cultural humility is really exciting me even more. I'm working with Strong Start right now on a PLC concerning cultural humility and cultural competency, and I'm hoping to be bringing it by the springtime. But to hear everyone touch on this topic, it is needed today more than ever. We all need to open our hearts, open our doors, open our minds, and come together for the benefit of all of these kids. Because if we can start everyone on an equitable playing ground, imagine what the future could hold. That's where my excitement comes in with all of this.
Leah, just PLC, I'm not sure everyone's familiar with the term.
It's a professional learning development course through Strong Start.
Wonderful. Thank you so much.
You're welcome.
Amy, I'm really feeling the lyrics in the chat, bopping with it. Absolutely. And Eliza, been waiting for you as well. Go ahead.
Yeah, I would just echo, I think a lot that has been said of, I think this has created a space where there has been a lot of silos. I think that was something that was brought up in Healthy Beginnings a lot. And so I would definitely just, continue to prioritize including all voices and collaboration, even between the work groups at times, especially when there is that overlap. Because I think having the different voices, and you guys are doing great of like including not just people who are directly working with families, but having that broad approach is huge. And I think that's one of the ways that elevates the field and the different professionals in it, is when you're right up in that face of talking with people and they're like realizing, oh, there is a wealth that is already in early childhood care and education. There are so many extremely knowledgeable and passionate people that are coming from backgrounds that are just really connected with families. And so that's it was brought up earlier, but definitely we want to make sure to include families and parents in these conversations, because they are the true experts and they are the ones that know what they need, and having a voice at a table has buy-in. So from families and parents to also pediatricians, and I know it was brought up like other mental health and DCF, like having all of those voices, making sure that they're included is important, and the cross collaboration between all those groups is huge.
Wonderful. Thank you so much. Anybody else on any ideas about what we should be merging together? I saw some things in the chat. Marissa, you listed some there, and I see there's some other folks who are seconding the things that you're putting together. Just looking to see if anyone had other ideas about themes or things that we should maybe group together.
I just want to flag Eve Gilmore, who did kind of real thoughtful, great to have this, expertise, but really the missing piece of people not in early education and care. We had a meeting with the data team yesterday. Kate Roper from Department of Public Health. That is the work that we need to do. We need to broaden, invite, engage, get reaction from, help us find people who are in your communities who we should be connecting with around this. I really appreciate you flagging that, Eve. It's something that's what's keeping us up at night right now. And we need help thinking about that.
Please continue to use the chat to put in comments as well, just for those who are willing to go live and share any thoughts that they're having about what we can combine or themes. We'd love to hear some of that, or anything else that you heard during today's session that you want to make sure you highlight or bring forward. Nancy.
Hi, I think it would be helpful for me to process everything, to look again at all of them, because
let's do that.
It's hard to know how to, what to blend and what to take out. So is that going to be possible? Will that
Absolutely.
Okay.
Let's actually, if we could take like a minute or so, and let's put on the screen each of those 5. Start at the first one if we want to share the first working groups 5. So go to the next slide. All right, let's leave it there for 30 seconds. Again, these will all be on Basecamp. You'll be able to make comments there as well. Just want to go to the next one. Yeah, let's leave it there for 30 seconds. All right. Take it in, see if there's any that speak to you. See if there's any emerging themes. Let's go to the next one. All right, let's go to the next one. You can visit with robust systems for 30 seconds.
And Megina, I see your comment, and there's been a thread. Our assignment originally was around problem statements, which is why it does sound like problems. Groups are at all different parts of that, but our fearless partner in crime, Dr. Kim Lucas, has really helped us with this process that she has been using. So I appreciate that flag and feedback, but it's by design, which can not feel as good as the solutions.
On to the next one. All right, let's take a beat here and take this one in. All right. So hopefully you've got a chance to review some of these and see if any recall. And thank you, Nancy, for pointing it out, because you were not the only person who wanted to see them again. Sometimes it takes a little bit of leadership and push to make those things happen that make it better for everyone. So I want to thank and celebrate you for pushing it forward. Now that you've had another chance to kind of review these, anything that has come up for folks? I see Donna said mental health supports across the groups. Go ahead, Nancy.
Well, I saw the perception of the field in the first group, and I also see that in the workforce development, and I saw retention of staff in the second group, and that's also in the workforce. So somehow, combining those.
And then just folks remember from our beginning that we'll be putting some things together and finding which working group it should fit in, so nothing gets lost. Any other thoughts on what we can combine? Or if there are anything that we need to split up?
I just want to elevate Jocelyn's point in the chat too, that there are common values that we're seeing across many of the different working groups, but that the to-do item might look different depending on the topic area, which is a really good point. So we should be mindful of that too, as we're trying to kind of reassign or move things around over the next week. Deanne.
I'm gonna ask one more question before I pass it back to Marissa to do our next steps. There is a desire also to think about how these things relate to and get down to root causes. And so just want to see if there's any place where we could be more explicit or direct about getting and drilling down to root cause. See if folks have any thoughts on that.
Repeat that again.
Just in terms of getting down to addressing root causes, if there's any space where we could be more explicit, or the places that we are addressing it and could be more direct.
So Mo, this might be obvious, but I just have to hold up my friend Diane Ether again, who started us out at the very beginning saying, if we don't have resources, we can't do any of this. We know what we need to do. We have to have the resources to do it. So again, just want to underscore that. Thanks, Diane.
Thank you, Dodie.
And another root cause I would say is the data piece. We gather so much data, but we don't look at the data to inform. And we were trying to look at just simple maternal health data. We don't have Boston specific, but we do gather it because we have baby borns all the time and so many surveys going out. And one of the pieces that I don't get tired of expressing is the importance of closing the referral loop. Referrals are happening. Hospitals do know it, but how are we sharing that data to understand where the deserts are at? So I think that like somehow we got to figure this out. I've been doing this for 10 years. Some of you your entire lives, and I'm tired for just 10 years. Imagine everyone else. So we need to figure this out. And I believe it's a top priority. I mean, it's of interest of us all to understand each of our cities, because we want to do something about it for that group of people, because every city is different and we have the power to do so. But I don't know what it is that is missing. Is it willingness? Is it fear? I think we got to let go of fear and really function out of this place of love for the people that we serve.
Thank you, Danubia. I see some comments still going in the chat. Keep it going strong. But I'm at that moment where I have to pass it over to Marissa, or else she's going to take it from me. So I'm going to give it to her willingly.
Thanks, Mo. All right, so I wanted to start by elevating Kim Davenport's comment in the chat and wondering sort of, are we going to pressure test this with people who aren't at this meeting at this table right now? And yes, that's the big part. That's sort of the next homework objective for all of us. And I think there's two ends to that. So one is just bringing in as many partners as we can and thinking about some of those other areas outside of early education and care that aren't represented here right now, and how we want those partners to be a part of these conversations, but also relying on all of your individual networks and the people that you are connected to that may sit at different points within the system that we can ask to give feedback on this sort of step in the priorities. So what we're going to do is, based on the incredible feedback in the chat and just everyone's comments here today, move some things around, try and edit, try and clean up those lists of priorities, and then develop a survey so that we can send that out. That'll say, here are the priorities for financially secure families. How does this seem? Does this seem right? Are we missing something? Is there a gap? Other opportunities to provide feedback, something along those lines, so that we can mass sort of send that out to the world and get as much feedback as we can for people who haven't been involved in the process sort of throughout this entire conversation. So I put the game board back here. It's saved in Basecamp, so you can kind of see where we are now. And It's really just about sort of getting feedback from a larger audience on everything that we've discussed today over the next 2 weeks before our next meeting. So we'll do that. And then on the next slide, we have just a couple other things outlined. So the first is the survey, gathering resources and identifying partners. So I believe it was Katie White's point too about like there's a lot on this list right now. There's a lot of things to do. And as we think about transitioning from the problem statements to solutions, that list is only going to get longer because there's a lot of solutions that can kind of fit under each of those different problem statements. So what we want to do next is really think about who is doing work in these spaces. How can we sort of connect to that work, support that work, and create those sort of feedback loops with the agenda and gather resources. So when we think about the briefs and the white papers and the data, everything that we might need to make an informed decision to decide what is sort of the next step, what is the action step for this, to pull all those things together and get them on Basecamp. So those are sort of some of our next steps. And then we are also, we have a 9:30 call at night scheduled for tonight from 8 to 8:30. So just another opportunity to get some initial feedback from the field at large on these priorities. All right. And then I think the last thing I'll share is the stewardship team nominations. So the sort of final piece of this puzzle that's missing is the stewardship team, which is really going to be supporting us at Strategies to sort of guide the strategy and the sort of next steps of the early childhood agenda. And what we really want to do there is create a very close tie between what we've all identified as priorities and the organizations who are doing work in those spaces. So if there are organizations that are planning to file legislation, that are developing agendas, that are content experts in certain areas, if there are individual educators or home visitors or pediatricians, anyone who has that content expertise, we want to get a list going of some of those individuals, and we'll sort of facilitate a nomination process over the next 2 weeks so that we can get that team sort of formed and up and running and start to meet for the remainder of the early childhood agenda. And that is it. So I will turn it back over to Mo for any closing comments.
All right, good people. I want to do two things. One, just thank you so much for hanging in with us on the Tuesday before Thanksgiving. A lot of people didn't think we'd get a lot of folks today, and we had over 80 folks, maybe even 90 folks come. So I just want to thank folks for their perseverance and diligence in doing this. Thank you so much for all the amazing comments in the chat and all of the ideas that you've put forward. Thank you folks who came live and participated as well. Thank you, Amy, for the wonderful song lyrics. They're going to be with me all weekend long, and I'm trying to envision you with the big teased out hair, because that's the 80s that I remember. And want to encourage folks to continue to make comments using Basecamp on the individual priorities, on the vision statements for each of these working groups, as well as any place where you see things that we can collapse together or where we need to go deeper. Lots of wonderful issues were brought up today, and it's a real tribute to the field, how we are doing this, not just that we are doing it. So, and that's because of you all. So thank you so much. Amy, did you want to say anything to close us out?
Just a big thank you. And just for folks, such thoughtful, we would love to use some of this for quotes. So, you know, like I can just picture a rolling slideshow of people's words. So we'll be in touch, but it was really incredible to be here today. Thank you.
Thank you all. Have a great Thanksgiving, and we'll see you all in next month.
Take care. Bye-bye.
Bye-bye.